Let's discuss the Chinese and Western medical thought. Evolution of TCM theory, part 2. The first serious challenge to ancient Chinese medical theory was influenced by philosophical trends similar to those associated with the logical positivism and Karl Popper in Vienna. Like the logical positivism, the Western-trained scholars like Yu Wan deemed unobservables in Chinese medicine as metaphysical and hence meaningless. They regarded Chinese medical theory to be unfalsifiable and therefore unscientific. In defense, Chinese physicians cited extensive historical clinical records of successful treatments using Chinese medicine. In addition, they appealed to the authority of ancient Chinese philosophy on which medical theory was based. The clinical record of Chinese medicine was difficult for Western doctors to dismiss, as many of them acknowledged the widespread existence of prima facie evidence of the efficacy of some Chinese medications and of acupuncture. But they insisted that the efficacy of Chinese methods were subjected to formal testing in accordance with the rigors of Western scientific tradition. As to invoking the wisdom of an ancient philosophical system to justify medical theory, this convinced few detractors as it was seen as merely shifting to the burden of proof from medicine to ancient philosophy and implicitly admitting its scientific inadequacy. Following Mao's decision to modernize Chinese medicine, the first national textbook for instruction in TCM appeared in 1958 entitled Outline of Chinese Medicine. Subsequent texts covering different subjects within medicine displayed deliberate similarity to their Western counterparts, and they constituted a massive and unprecedented systematization of Chinese medical theory and practice. Regulations of TCM practice was introduced through the licensing of medical practitioners at the state level with common national examinations. Since modernization, the TCM universities in China have required about 30 to 40% of students' time to be spent on studying Western medicine. Graduates can practice basic Western medicine in addition to TCM. They can read modern diagnostic test results, prescribe Western drugs, and perform simple surgical procedures. Research publications in TCM have yet to catch up in terms of rigor and methodology with those in the West, but their increasing numbers and improving quality attest to the recognition by TCM scholars that their theories and therapeutic methods should be put to test similar to those used in evidence-based medicine. Referring to the systematization of Chinese medicine, Sieben opines that such change had been most decisive over the past generation with unmistakable influence from modern medicine. Shed notes that the transition was not without its controversies and contends that despite the apparent uniformity forced upon the TCM community by state-sanctioned textbook and clinical practices, there remained a plurality of views among scholars and practitioners. Shed observation especially pertinent considering that conservative scholars like Lu Lihong continue to regard the classics as the ultimate authority on modern despite their formal training in TCM as the modern systematized from of Chinese medicine. They treat TCM as the product of adulteration and distortion by Western interpretation. Such conservatives seems to be a dying breed. As much as the systematization of Chinese medicine was considered a radical transformation in the 1960s, the truth of the matter is that Chinese medical thought was largely stagnated since the emergence of the Nijing, as if time was virtually stood still after the theoretical breakthroughs of the Han Dynasty. Indeed, generations of modern scholars of Chinese medicine have continued to treat the Neijing as the source of all Chinese medical wisdom. Among conservative scholars, the presumption is that the ancient were gifted with special powers of discernment, which allowed them to use ultimate truth in medicine and record them accurately in the classics. Understanding this ultimate truth would be all it takes to grasp the theory of Chinese medicine, although an enormous amount of scholarly work was to be invested in interpreting these ancient writings, not unlike research on ancient scriptures. Thank you for your attention.